This is Dr. Pramilaa R, Principal, Chirai College of Nursing, Bhopal. This presentation is on the study that's performed by me on nurse teachers' lived experiences with students' impoliteness, a qualitative study. The presentation will go ahead with introduction, statement of the problem, objective, methodology, results, discussion, and conclusion. Incivility are those behaviors that are destructive and would lead to physical and mental distress in people who are working in that environment, and if not eliminated, could cause a threatening condition. Many teaching faculty feels incivility among students have become very common in the present scenario, and our fear is that when nursing students who engage in uncivil behaviors during their training period may carry those behaviors into their clinical practice, the place which we are always aiming at, quality patient care. Student incivility at odds with nursing faculty is acknowledged as a zone of huge concern in nursing education. The negative potential influence on nurse teachers is frightening. A warning to psychological and physical well-being may be disastrous to the recruitment and retention of faculty in the academic wing that is previously experiencing a short of qualified nurse teachers. When people encounter stress, uncivil behaviors become frequent, which in turn can aggravate into violent behavior if not overly controlled. The profession of nursing has consistently known for manifesting kind-hearted care, which I have just brought here in one word under the umbrella. Otherwise, the qualities that we expect are caring, communicating, empathy, problem solving, compassionate, commitment, and so on. Therefore, the prospective nurses representing anything less is apprehensive. Incivility depicts less concern for patient well-being and respect for human dignity, which is mandatory for professional nursing. This problem is magnificent and worrying, not only for the representation of nursing, but the influence it has on the healthcare environment too. The statement of the problem is a phenomenological study on nurse teachers' lived experience with student impoliteness. And the objective is the present study was aimed to explore nurse teachers' lived experiences with student impoliteness. The exploration was done on three areas: 1. Student impolite behavior, 2. Causes of their impoliteness, and 3. Strategies of overcoming impoliteness as described by the participants. Methodology. Let's see the research design. A phenomenological design of qualitative method was adopted for the study. Eligibility criteria. Participants who were willing to take part in the study, who were available during data collection period with 3 years of teaching experience were the eligibility criteria for selection. Sampling technique and sample size. Using purposive sampling technique, 14 participants were chosen. Tool for the study. A self-constructed semi-structured interview was prepared to provide directions such as asking participants' experience pertaining to common impolite behaviors. Data collection method. Descriptive data was gathered by one-to-one interview. The average time for an interview was about 35 minutes with a range of 22 to 48 minutes. Follow-up clarification was obtained as required. Interviews were audio taped and transcribed by the researcher. Data collection was done in the month of January 2019. Let's see the demographic characteristics of the participants before we go into the results. Majority 64.3% of the participants belong to the age group of 25 to 35. Majority 64 participants were females. 86% of participants had a qualification of MSc nursing. 64.3% of participants had an experience of 0 to 10 years. And related to the position, 28.6% were assistant professors. Based on the transcribed verbatims, main themes were extrapolated and subthemes were categorized under main theme. A total of 5 main themes were extracted. 1. Unbecoming behavior with teachers, and the subthemes were arguing with teacher, talking back, not accepting corrections, disobedience, enter the class without permission, speaks rudely, threatens teachers, of which 2 subthemes, arguing with teacher and talking back, was agreed by all the participants. Second main theme, unprofessional behavior with peers, fight between themselves, forms groups and bully others, pass sarcastic comments, gender bias, use abusive language, no professional values maintained, less manners, of which again 2 subthemes were agreed by all the participants, and they were using abusive language and no professional values maintained. And the third main theme was undesirable behavior in classroom. And this is the longest sub-theme that was extrapolated. Not paying attention in the class, sleeping in the class, not obeying orders, talking between lectures, disturbs others, not prepared for the class, use of mobile phones when the class is on, attention-seeking behavior, dominates the class, no formal posture while listening, ask inappropriate questions, makes sound during the class, come late to the class, destroys LCD cables, destroys mic, submits assignments late, of which 5 sub-themes were agreed by all the participants, and they were not paying attention to the class, talking between lectures, not prepared for the class, destroys LCD cables, and submitting assignments late. And the fourth main theme was academic dishonesty. And the sub-themes were speak lies, copy during exam, and copy assignments, of which copy assignments was agreed by all the participants. And the fifth main theme was aggressive non-verbal expressions. And the sub-themes were stare at faculty, stamp the foot, hit the door and walk out, of which majority 71% agreed. Most of the students were staring at faculty when corrections were given to them. With this we see what were the causes of impoliteness as described by the participants. Lack of parents' guidance, improper childhood grooming, impact of media, no role models, men in nursing, single parent, single child, peer group influence, of which 100% of the participants agreed lack of parents' guidance was a prime cause for the cause of impoliteness that was elicited by the students. And the strategies to overcome impoliteness as described by the participants were 57% of them said positive reinforcement and the motivation given by formal classes or by the teachers could help them. And 36% of them believed counseling with professional counselors, conduct teachers' parents meeting periodically, and formal guidance and counseling could help them to overcome. And 28% of them believed little more strict in the rules and regulations can help them. And 7% accepted encouraging peer help may help them overcome impoliteness. There were many studies that were supporting to the present study findings, but here I just brought 2 of them. One is the uncivil etiquettes reported in the study are serious and they can affect the learning process and professional earning of others in the classroom in a pessimistic way. Another study said disrespecting teachers enfolded disobedience means refusing or failing to perform said orders, and rudeness, which describes talking back and arguing with teachers. With this, I would like to conclude. Although the present study has elicited the reasons of students' impolite behavior, further research is recommended to assess the factors responsible for it, and it should be mandatory for all students to comply. Additionally, the findings reflect the contraction of values of nursing education. Value-based teaching should be inculcated and periodic measurement should be implemented and checked if it has been imbibed within the students, as it is essential for all the nurses in their day-to-day practice. Thank you.